Hi, everybody. I think we're going to go ahead and get started. I'm Dr. Heather Cook. I'm one of the physicians here at Coastal Fertility Specialists, and we're going to be doing one of our Coastal Quickies tonight. And the topic is a very important one, which is age and fertility. Now, obviously, age is a sensitive subject for all of us. None of us like to talk about or recognize that we are getting older, but it is a very important part of our fertility and fertility outcomes. None of us like to feel like there is pressure or we are being pressured because of our age. But I think there's a lot to be said for kind of taking control and understanding how age affects fertility and kind of being in control of your own fertility from that standpoint. So, we're going to first start by talking about ovarian physiology, which I think a lot of people are not aware of, kind of how we get our eggs and, do we keep making eggs throughout our life? So, interestingly, we develop all of our eggs when we are actually in utero, meaning when we're actually developing in our moms. We have the most eggs in our ovaries we're ever going to have, usually when we're about 20 weeks gestation in our mother's bellies. And by the time we're born, that number has dropped. And that number has dropped to about 1 to 2 million eggs by the time we are infants and by the time we are born. By the time we actually hit puberty and start having menstrual cycles, we are dropped even lower to about 300,000 to 400,000 eggs, which I recognize still sounds like a lot of eggs, but we do have a decline as we age. And then during our reproductive years, we do lose eggs throughout all of our reproductive years. So by the time that we hit age 40, we're down to about 5 to 10,000 eggs. Now, interestingly, when we get into menopause, which is usually around the age of 51 or so, we still actually have eggs in the ovaries. We still have about 1,000 eggs in our ovaries at menopause. And so it's not that we truly ever run out of eggs, but the less that we have to work with really kind of signifies that our ovaries aren't working as well and signifies kind of a diminished reproductive potential. And so I think that's one thing to understand, that we do look at egg number when we're assessing fertility and when we're assessing fertility from an age based standpoint. But that is not the most important part of the equation. The other part of the equation, which tends to be a little bit more important as far as pregnancy outcomes, is the actual quality, meaning the genetic makeup, the health, the metabolic components of their eggs. And that's ultimately what's going to determine our pregnancy success. So this is just kind of a graph to represent what we just talked about, just showing the egg decline as we age as women. And again, we get very low into our 40s, but we do still continue to have some eggs even up till the time of menopause. So, what does that mean for our fertility? Because clearly having eggs is one thing, but getting pregnant is another thing. So, this is a nice chart here just to kind of show the difference in pregnancy rates at any given age. And this is not in patients that have infertility diagnoses. This is not in patients who are undergoing fertility treatment. This is really just showing that if you start trying to get pregnant at these different age points, what is your chance of getting pregnant each month, again, without a history of infertility. And you can see that at age 25, of course, we're very fertile in our 20s. We would expect the monthly pregnancy rate to be around 20-25% in our 20s. That drops to about 15 to 20% in our 30s. And by the time we get to age 40, we know that the chance of getting pregnant on our own, even without infertility, is about 5% each month. And that's a little shocking to most patients when we go over those numbers, because we do see, in the media and with friends and family, that people are getting pregnant into their 40s. So I think it's a little surprising to people to hear that truly a monthly pregnancy rate at age 40 in patients that are otherwise healthy and don't have history of infertility is only about 5% per month. And so that's kind of what we're working with naturally. So again, we kind of touched on this a little bit, but patients always ask, well, if I still have eggs, I still have 5 to 10,000 eggs when I'm 40, and I still have 1,000 eggs when I'm 50 in menopause, and I'm still ovulating every month. I know that I am. I'm checking my ovulation kits. I'm having regular periods. So, why am I not getting pregnant, and why are those pregnancy rates decreasing as I get older? And this is kind of the whole idea of our egg quality that I mentioned earlier. And the reason for this is our eggs are the same eggs in our ovaries that we've had since we were born. So those eggs, when we're 40, have been sitting there for 40 years. They are not new eggs, they are old eggs. And I say that because I am 40, so I'm not trying to offend anyone who's 40. They are older eggs from a reproductive standpoint. And what happens is when we ovulate, the DNA actually separates at that point to kind of make our final DNA composition of the egg that's going to be ovulated. And there's actually machinery in the eggs that's responsible for separating out the DNA. And that machinery has also been in our ovaries and our eggs since we were born. And so it gets older as we get older and it doesn't function as well. And so when it has to pull apart chromosomes and it's not as healthy as it once was, it tends to pull extra chromosomes or it tends to leave chromosomes behind. And so as we age as women, if we looked at every egg that we ovulated every month as we get older, there's a much higher likelihood that we will be having abnormal chromosomes or abnormal amount of DNA in each of those eggs as we age. And so that is the whole reason why we start to have lower pregnancy rates. Even if we're ovulating every month, it's a higher likelihood that that egg is not healthy. And I wanted to go back to one more point on that. So, this is the same reason not only do we have a harder time getting pregnant, but it's also the same reason we have higher miscarriage rates. And so, you may have heard that as we get older, miscarriage rates tend to go up into our, late 30s, early 40s. And it's the exact same process where if we're releasing an abnormal egg, sometimes those abnormal eggs will actually fertilize and implant for a short time, but if they're not chromosomally normal, they usually will end in miscarriage. So, same process, just different kind of endpoint. And so you may be asking, how do we know this? And this is, one benefit of our IVF data and IVF testing. So when we're actually doing in vitro fertilization in women, we have the ability to actually test the genetics of the embryos. And so this is a little bit farther along. It's once the eggs have been fertilized and grown a few days, and we can actually test them. But you can see essentially the trend here that as we age, the percentage here is the number of genetically abnormal embryos. And so at age 25, we may have about 25% abnormal embryos from a chromosome standpoint. And by the time we get into our early 40s, it's about 80% of the embryos that are going to be abnormal. And from an egg standpoint, it's probably a little bit higher than that. So, how do we test for this? So, how do you know what your egg status is? And so, we do have some testing options that we have to kind of give a woman a sense of what her current ovarian reserve is. We can do an ultrasound in the office, and we do what's called a resting egg count, or sometimes referred to as an antral follicle count. And it's really just us counting the eggs that we see. And you can kind of see a picture of an ovary here. And each one of these black circles, I always say that they look like chocolate chip cookies. The little chocolate chips in here, those are the eggs that we're counting. And so that kind of gives us a sense of how many eggs from a number standpoint we're working with. We also have some blood work that we do that kind of gives us a little bit better idea of both the number and the quality. I say that because quality is a very hard thing to assess when we're just doing kind of overall testing without looking directly at the eggs. But that's usually done on the third day of a period. And it's a panel of blood work which checks some of the reproductive hormones. Commonly, those are FSH, which is follicle stimulating hormone, LH, which is luteinizing hormone. We'll check an estradiol level with that, and then one called AMH, also known as anti-Mullerian hormone. And so those again give us a little bit more insight into kind of the number and a little bit more into the quality. I always make this point to patients, however, because it can be very confusing looking at all these factors, looking at the egg number, looking at age, what do we use to tell us what our true fertility is? And age, we know, is still the most important and most determining factor of pregnancy rates. And what I mean by that is if I have someone like myself who's 40 and all of my blood work looks pretty normal and my egg count looks pretty reasonable, that doesn't mean that I'm going to tell the patient, okay, well, normally at 40, your pregnancy rate's 5% per month because all your testing looked normal. That bumps you up to 50%. That if it does not look good on the testing, and the testing, for instance, the blood work is very abnormal, then that's a situation we may say, okay, well, we said that on an average 40-year-old, we have a 5% pregnancy rate per month. The blood work is showing us that your ovaries may be, further along on the process than a normal 40-year-old. So we may actually have a worse pregnancy rate if the blood work doesn't look good. This is a question we always get asked, which we wish we had better answers to, is what can I do to improve my egg quality? What can I take to make my eggs healthier? And unfortunately, there are not a lot of good answers to that. And you can imagine, because this is something that all fertility doctors, deal with on a daily basis. We would love to have something to give patients to make the eggs better. And there have been loads and loads of studies looking at different diets and looking at different treatments and supplements and medications to try and see if there's anything that we can do know of to reverse our aging of our eggs or make them better. And there's just not a lot of things we know that do that. Some of the things you may hear about, and some providers may recommend, and again, this varies provider to provider because there's just not a lot of great data or evidence on any of these that they truly do improve egg quality. But coenzyme Q10 is a very common one. I personally recommend that to my patients just because I think it has a lot of other good effects, and it may help our egg quality a little bit. That's an antioxidant, which has been shown in some animal studies that it actually can improve at least the metabolics and the enzymes and kind of those components of the eggs. Growth hormone is something that we use more specifically when we're doing IVF treatments, and there are some studies on growth hormone during IVF where if we give injections of growth hormone, that may help our pregnancy rates a little bit from an egg quality standpoint. DHEA is an older one that people used to give. The studies on that one aren't super convincing, so I'm not really a fan of recommending that, but you may kind of see some providers recommending that or see, literature on that. But again, none of these things we know really truly like make our eggs healthier per se. So then the next question becomes, well, can fertility treatment improve my outcomes from what we've already talked about? And the answer is yes. Fertility treatments can improve our pregnancy rates kind of from what our baseline rates are at any given age point. Can they fix the problem completely? No. And so we are still working with egg quality as a factor when we're talking about fertility treatments. So just going through some of the fertility treatment options, one of our more simple options is something called intrauterine insemination, where we basically give the woman medications to try and make a few more eggs each month to grow kind of what's there, and then put the sperm into the uterus to help it along. And you can see that even with that, the pregnancy rates do differ. At 35 and under, we're about a 20% pregnancy rate with IUI. And you can kind of see that slowly decreasing as we get older. And at age 40 with IUI, we're probably about 5% with those treatment options. So it can help, but it can't totally reverse the process. The other option is IVF, which most people know is one of our more aggressive fertility options. And I do have a lot of patients coming in thinking that IVF, will kind of fix the age issue, and that if you're 47 and you do IVF, then that's going to be able, to bypass the age issue. But again, we are still working with the egg quality that we have. And with IVF, we can usually help a woman grow more eggs and utilize more eggs to try and find a good normal one in the bunch to get the pregnancy rate up. But we do still know that age is a major player in our IVF pregnancy rates. And you can see that here. This is a nice kind of national graph. This is not coastal fertility data, but it's a national graph, just kind of fertility centers across the country. And you can see that age is on this line here. So we're starting at age 21, going up to age 40, 46, 48 over here. And then this is the percentage likelihood with IVF of pregnancy. And you can kind of see how that declines and gets very low into our kind of mid to late 40s. And that's even with IVF treatments. And again, this all boils down to the genetics of the eggs and kind of what we talked about before. So then I guess the question becomes, what if I don't have any more normal eggs? What if we just can't find any normal ones in there due to an age factor? Am I out of options? Is that it? And that's not it. We have a lot of other options because we have a lot of women in the situation where, for whatever reason, we have older ovaries than we should for their age, or we're starting our families later in life and we just maybe don't have the amount of normal eggs that we want to have. And so options at that point would be to use an egg donor, which essentially is similar to IVF, but we're basically adopting an egg or using an egg from an anonymous donor to improve and kind of fix that egg quality issue. We also sometimes utilize embryo adoption, which is embryos that have already been made, and these are usually from couples that have gone through fertility in the past that have not used all their embryos, and that again would be an egg and sperm that have already been fertilized. We can use those. And then traditional adoption is another option in that situation. So we do have another talk, specifically on egg donation in much more detail. So if you're interested in that, we have a lot more information on one of the YouTube videos. But just briefly, how does egg donation work? We basically take eggs from young women who have been tested and screened to select them for their good egg quality, meaning we're expecting them to make a lot of eggs and we're expecting them to make a lot of normal, healthy eggs. Um, these donors are very heavily screened. They're very heavily tested before they're accepted into the program. They go through an IVF process to get the eggs out. And then at that point, they are fertilized with the recipient partner's sperm or donor sperm to make embryos. And then those embryos will be transferred into the patient's or the recipient's uterus to kind of optimize the pregnancy rates. So the big question is, how well does that work? Does the uterus show signs of aging? Do we have lower pregnancy rates even if we're carrying somebody else's egg or a donor egg or another embryo in our uterus? And the answer is it works really well. And so this chart here, you can kind of see with IVF in pink. As we get older, we know that those rates drop as we've already looked at. But in IVF with donor eggs, that pregnancy rate is pretty darn consistent no matter how old the recipient uterus is, meaning that it really is an egg quality issue, and that by utilizing a healthy young egg, we really can reverse those pregnancy rates back to what it would be in our 20s. And that's an option really for anyone up to about age 50 with appropriate testing and screening. We can get these high pregnancy rates with egg donation. So a question that you may be asking yourself is, how do I be proactive about that? How do I make sure that I'm, going to be in the best place I can, utilizing the eggs that I have and kind of setting myself up for success? So, ovarian reserve testing is always an option if you are trying to get pregnant or considering pregnancy or thinking about, I wonder what my eggs look like. We can always do ovarian reserve testing to give a woman some idea of kind of where her current fertility from an egg status standpoint is. If you are trying to get pregnant and you're over 35, you may want to seek evaluation a little bit sooner than if you're under 35. So usually we will tell patients if you're over 35 and you've been trying for 6 months or more, we want you to come in for some evaluation to get the kind of ball rolling and see where the egg status is. Um, if you are wanting a large family, and we're getting into, again, that, mid to late 30s, early 40s, we would counsel patients, let's kind of get a little bit more aggressive. Let's not wait 2 years or 3 years before babies. Let's kind of make this happen a little bit sooner so we're not racing against the clock or trying to do things when we're in our early 40s, which may be much more difficult. And then we also have the option of egg freezing. And so we have traditionally used egg freezing to preserve fertility for later on. So if you're not ready to get pregnant right now, we can always freeze eggs to have those as a backup for when you are ready to get pregnant. We do also have some situations where patients come in and maybe they are 40 or 41 and they are just starting their families and they want to have more than one baby. And so sometimes in those cases, we'll even freeze some eggs then to be used for later before we do IVF and before we get pregnant at age 41. So that when they come back when they're 43 or 44, we have those eggs there to use. So there's a lot of different ways we can utilize egg freezing. So that really is kind of the conclusion of my presentation. I think the main takeaway points from today is age, we know, does play a large role in fertility. It's not a deal breaker, but it is important for us and it's important for our pregnancy rates. I do think knowledge is power. And so I do think knowing this and knowing truly what fertility and age mean is important. I think a lot of my patients tell me, Dr. Cook, we get told over and over and over growing up about how not to get pregnant and how to use protection. And then if we don't use protection, we're going to get pregnant immediately. But nobody ever tells us that we may have a hard time getting pregnant. And as we get older, we may have a hard time getting pregnant. It's something we should think about earlier on. So I think knowledge in that sense really gives a patient power. And then I think being proactive in all the ways we already talked about is very important for women to kind of take control of their fertility, take control of their options, and kind of set themselves up for success, since we do have so many great options available right now. And then finally, there are options for everybody. So I know this is a slightly depressing talk about age, but I just, want everybody to know that there are always options. And even if we are in that lower pregnancy rate, we have other options, and we can create families and create pregnancies in a lot of different ways. And that's my little silly attempt at a cartoon that IVF is unable to fix old eggs, and I don't even know what those birds are, some sort of duck.
We do have one question.
Okay, sure.
So Amber wants to know, which is more indicative of success, age or AMH?
So age. And so AMH we think of as more of an egg number marker. And so AMH is a hormone that is made by all those little resting eggs. And if we go back to that picture of the ultrasound, each one of these little resting eggs and follicles produces AMH. And so the more AMH we have, that tells us that we have more eggs. But that does not tell us anything about the quality, and that does not tell us anything about the success of those taking. And we see this a lot in our patients. I think the most classic example of that is our patients that have PCOS, where patients inherently have a lot of eggs. And so they may be 40 or 41 and they have 20, 30 eggs, and their AMH may be very elevated because of that. But the quality of those eggs is still the quality of a 40 or 41-year-old. And we see that very clearly when we do IVF. We may get 20 eggs, we may get 10, 15 embryos that we test, and we may have none that are normal or one that's normal. And so I would say 100% age is more predictive than AMH. So I think we'll conclude. I don't think we have any other questions, and we will post this video later if anybody wants to, view it at a later point. And I think that we'll go ahead and end. Thanks everybody for showing up tonight.